All right, good evening and welcome to your view with me on Khopotse JJ Tabane. Our frank talk tonight is with political parties around the table who are going to tell me what they think of how the coronavirus epidemic is being handled and what else we should be doing as citizens, what are they doing as political parties, and so on. Dennis Bloem, a regular here on Your View, a spokesperson of COPE, Dr. Lawrence Matsetela, who is the EFF commissar responsible for health. I think it's your first time. You're welcome. Thank you so much for making the time. And then another regular here, Mzwanele Manyi, who is the head of policy for the ATM. Thank you so much, Mzwanele, for being here. Sure. And of course, joining us on Skype is the DA spokesperson, Malatsi. Good evening to you as well, Malatsi.
Good evening, JJ. Yeah. Good evening, JJ, and to my colleagues in studio.
Yeah, thank you. Gentlemen, welcome.
Thank you. Thank you very much, JJ.
Yeah, thank you so much. Bloem, just kick us off. Overall, are you happy with how government has risen to the occasion through its various ministries and so on in terms of handling this crisis on behalf of South Africa?
JJ, we must say that under these circumstances, government have tried, but a little bit too late. If government have put in their machinery, maybe earlier on, then it could have been better. But we are saying, as the Congress of the People, there's no time to point fingers now.
Yeah.
What we must do now is to assist and help that this virus must not spread and kill many of our people.
Yeah.
It's no use that we are going to point fingers now and say that, no, this one is to be blamed, that one is to be blamed.
But you are saying they should have acted sooner.
Yes.
All right. I'll come back to you later to just understand what other things could have been done and whether or not those things that were not done sooner can still be fast-tracked. Doctor, your view from the EFF?
Thank you very much. From the EFF's point of view, we acknowledge and appreciate there were effort made from the side of government. Although the issue is that the timing, we acted a little bit late. You remember we made calls before earlier on, around the 5th, the 14th, that there should be bans, there should be a drastic measure that should be taken.
Yeah.
Yes, but like the COPE said, we can't be blaming each other now. We need to focus on the future. We need to arrest this disease. This is a problem of South Africa currently. We need to unite as political parties. We need to unite as business. And everybody must be hands-on on this to curb this thing. And we can defeat it if we are united. There is power in unity.
All right. I'll also come back to you to just want to understand this, pace of action that you are talking about, whether or not, so that it's learnings for the future, to see how quickly should we be acting, because also if we act too hastily, people may say, but that was too hastily, you have not considered everything. But I'll come back to you on that. I just want for other colleagues to give me their openness. Manyi?
Yeah, no, firstly, I think for us as ATM also, we welcome the announcement.
Yeah.
In fact, we also support the various interventions that are mentioned. And indeed, like my colleagues here, we just lament the lateness of all of this. You must remember that the outbreak started in December last year. And when all other countries were busy with lockdowns and everything, we're busy with hand washing. And I'm in Kenya, with one person having been infected, they did a lockdown. We're busy with washing hands. So really, we think a lot of time was wasted in that, and for government to have waited until we are at 61. Well, it's really, there was no new information that they've had on Sunday that they didn't have 2 weeks ago. So this is characteristics of this, it's characteristic of this sixth administration to be dithering when everything, they just cannot make decisions. Even this Sunday decision had to be preceded by another summit, a mini summit of cabinet. This is the challenge that we're facing. We're hoping now that with the national disaster that has been put into place, that there's going to be a lot more pace in doing things, because with the act that is in place now, what it means is that the Kokta minister, in terms of the act, is empowered to make regulations just like that. I mean, they've got power to dictate. There's no requirement for a 30-day consultation period and all of that. If it decides that, like for instance, what we think now as ATM, are the actual decisions that must happen right now in terms of these new regulations with the Disaster Management Act. What should happen now? Government should issue a regulation and say that there should be a ban on food price increase. Government should issue a regulation now and say that there's free testing in all the clinics. Things like that. There must be drastic decisions.
All right, we'll come to that because there are people are arguing also that in fact you need a state of emergency. And I would like to hear what you guys think about whether or not the issue of state of emergency could mitigate what you are calling slow action. Because they've now created, they've said state of disaster. It's a half measure according to other people. And then maybe after we're at 200 tomorrow, they will then start panicking and say state of emergency. But we'll come to that. Let's just hear what the DA has to say. Malatsi, is there anything from the DA's side that you may have added to the measures already taken?
Absolutely. I think, it's important to recognize that the measures that government has taken to date are necessary in order to steer the country through this difficult phase that we are in. And perhaps there are interventions that could have happened earlier that would have helped contain particularly local transmissions that have happened. But I think we are now at a stage where everybody in every sector needs to be doing their bit to make sure that we contain as many local transmissions as possible. So the measures that have been put in place, particularly the travel bans, and I think it's necessary now to look at how you increase capacity for testing to make sure that, one, the National Institute of Communicable Diseases has the capacity to deal with the volume of testing that is going to be necessary in order to measure the penetration of the disease, but also making sure that those people that have the skills, the retired nurses, this is the time to make the appeal for them and make efforts in engaging them in order to come into the system and make contribution so that we can use all the human infrastructure that is there and the public service infrastructure that is there to prevent further transmissions, particularly in dense populations such as township, rural areas, where the public health infrastructure system as is wouldn't cope with large volumes if they were to increase. And more also bearing in mind the socioeconomic conditions in these areas where many people, particularly breadwinners, wouldn't be able to self-quarantine or socially distance, keep social distance because they need to be able to provide for their families. So part of the proposals that we have made into government is moving towards the loan forbearance for businesses in terms of rental, for loan forbearance, so that income owners or breadwinners in families can have that relief, particularly for the next 4 months, because even if we get to a stage where we clear the virus in the next month or two, the economic effects would be felt far more beyond that time.
Yes. I will just come back to the table here. That Bloem, do you think we are at the mercy of government in terms of looking at the state of service delivery, which is parlous? I mean, we've had so many stories about communities that don't have running water and so on. Those things are not going to go away just because there's a virus necessarily. But maybe they should go away, and maybe there should be a trigger for action. But do you think we are in a danger of being at the mercy of that kind of state of service delivery in dealing with this virus, and how can that be mitigated?
You see, JJ, if this government for 25 years have addressed these problems in the informal settlements, in the townships, we could not have this serious challenge that we are having now. Water is a basic right of everybody. But now, here we sit with this problem, with this crisis, and now we must talk now about water. A month ago, the people of Twatwa were up in arms There's no water there in Kwakwa. Now, all of a sudden, no, there will be Jojo tanks, there will be what the Minister of Kokta today have announced that all over the country, in informal settlements, in villages and what. Why are these people not, if there was not this virus, could they have sit and wait and not address these problems? A lack of toilets in this villages, township, informal settlements. We were there during the election, there in Kliptown. Kliptown. There's no toilets. People, more than 500 are using one toilet. Now, that causes a very serious challenge to this virus. If we are not going to speed up, but you have asked a question, and I can tell you, we will say, let there be a state of emergency.
Why? Why?
Because this thing, from 116 yesterday to 150 today,
and the minister is already saying tomorrow it may rise to 200.
I can tell you, if we are not going to cap and to address this thing very fast, many people are going to die in this country. I am saying, if one person in the informal settlement can you imagine in Diepsloot, if one person, the shacks are like this, how will this health care people know? Maybe as we speak now, there are many people that is already infected, but how will you reach such people? Even the police can't go into those townships.
All right, we're going to come back.
Now, it's very, very serious.
All right, I'm going to come back to the state of emergency issue because we need to break it down for people, because state of emergency triggers other memories about how
I'm a victim of
done,
state of emergency.
Yes. So we need to understand state of emergency in the New South Africa. What would it mean? How will it be different from the state of disaster that is already in place, that was put in place on Sunday? We are talking to political parties around the table, the ATM, the DA, the EFF and COPE. Join me tonight to analyze the state of things in as far as the COVID-19 is concerned. Stay tuned. All right, welcome back to Frank Talk tonight with political parties, the EFF, COPE, ATM, as well as the DA. Doctor, let me come to you. From the EFF point of view, a state of emergency, you'd have declared that already if you are in charge?
Not really, JJ. Let's put things into perspective. I think, Ella, you asked a question about if we are really under the mercy of government.
Yes.
And it must be clear that we are definitely, our people are under the mercy of government. And let's put things into perspective in the Department of Health. We embarked in a program where we visited clinics. Our clinics are dysfunctional. Our clinics are not working. In some of the hospitals, there's no water. In some of the clinics, there's no water. When you go to rural areas, I mean, I'm residing in Sekhukhune, for example. Only 6% of residents of the villages in Sekhukhune have access to water.
6%?
Only 6%
of villages in
Sekhukhune have access to water.
That sounds disastrous.
It's a very serious problem. It's a problem that is going to be beyond us if it's not properly managed. That's why as EFF we are insisting that resources must be brought to the municipal level, where issues like sanitation, issues like water will be dealt with. So yes, that is true. I don't see the difference between if you declare the state of emergency and
state of disaster.
Yes, we've made this call, and it's a very critical call. We said that government need to how do I put it? Government need to go and ban the people from traveling outside.
Yeah, travel ban. Yes.
Travel ban. And then we further said government should state isolate. We were put it clear on our statement that we need the state isolation. That is the word that I was looking for. Now,
state isolate the country, so close all the borders.
No, state quarantine to be proper.
Yeah.
That is the word that I've been looking for. And if you check currently, we are no longer being in trouble getting cases from outside and so forth and so forth.
These are internal cases.
Currently, we have an internal issues that is a problem. We have said to government, we need to quarantine people. The state needs to be in charge and quarantine people and force people to be quarantined. Currently, I mean, let's put an example. We have a situation where somebody, even after the situation has been declared, we have somebody who's traveled from China, go to Netherlands, go to France and so forth, and come back is tested positive. And after being tested positive, you are saying to that person, go home and quarantine yourself. That is not going to happen. If that person was not disciplined enough to stop from visiting all those areas, we are not going to control these things. And
so are you calling for quarantine of those who are positive?
Yes, we are saying
all those who are positive.
All the people who are positive
must be quarantined.
Must be quarantined. And we have made a recommendation when it comes to that. We said that we have a place like Robben Islands where we can quarantine our people.
You're asking people to go to Robben Island? Woman.
Yes, that is what we put on the proposal. And we're not saying completely Robben Island. We're saying that or other.
It's a prison.
No, it's not a prison. It's a prison.
Museum now.
But we can convert that Robben Island into a quarantine zone of people. The advantage is this. Once you isolate everybody who has tested positive, once you isolate them, you can manage this thing. I mean, JJ, imagine the day this disease goes to a human settlement, somewhere Winnie Mandela, the day this disease goes to a Sukukune area, where there's no flow, there's no water for almost, only 6% of people there.
It's going to be a disaster. But
it's going to be
that sounds to me like that's why you need a state of emergency. But let's hear what others have to say. A state of emergency, state of disaster, any difference?
Yeah, no, look, I think the kind of cooperation that this government is getting from society out there does not necessitate a state of emergency. The state of emergency suspends a lot of regulatory framework that is currently in place, suspends a lot of things. It's just government dictating left, right, and center. With the national state of disaster that we have now, a lot of other laws elsewhere can still operate normally, purely because there is a lot of cooperation. In fact, it's a cooperation that this government does not appreciate. I mean, today, for instance, just to give an example, was a consultation with faith-based organizations. Now, you would have thought that they would have mapped up the whole country to make sure that everybody is invited. But all they have invited, people that they've excluded, basically, just so that it's clear. People that were excluded here are people of the African spirituality, a huge church, the Revelations Church of God, under the leadership of Prophet Dr. Khatel, which has got a huge member base, other church members as part of it. This prophet,
and they think they excluded them deliberately, or it was a question of numbers?
This is a constituency that should have been part of those numbers, instead of a duplication that was there. This is a specific group. African spirituality was not represented there. They have a huge base of some 10 million odd members, these people. So, and by the way, they are still cooperating, but they are saying, government, why is it that us as the Revelations Church of God, why us as in the African spirituality are being locked out? The traditional leaders, why is it that we haven't heard, when are they being consulted? So all these suggestions, people are ready to make these suggestions, but we've got a government that for some reason is not taking advantage of the positivity in which people...
And the goodwill.
Yeah, I mean, there isn't...
I suppose they're still consulting, lots of people are consulting business, labor, they're coming to...
The reason Vuyo Zungula, the president of ATM, is not here today is because he is doing part of this work to assist this government. He's out in the Eastern Cape talking to some of the big churches there, like a TACC, for instance, which is also... was not part of today's proceedings. Yeah. So he's there to go and give these messages and all of that. Yeah. Tomorrow is going elsewhere and all of that. Everybody is trying to assist. Yes. I think it's important that government must understand that the issue of trust deficit has befallen it. People don't really trust this government. And therefore government must realize that it's not really trusted. And therefore it depends on the people that are actually trusted. People believe in their bishops. Yeah. People believe in their spiritual leaders. People believe in their traditional leaders and all of that. So you would think that government would know this and do the right thing. Instead, what you get all kinds of confusing messages. I mean, JJ, just today, if you go to Premier Makura's timeline, he says that if you are going to have a wedding or a funeral or something of more than 100 people or something, notify the police station. And then you say, okay, tick a box. And then before the day is over, then you go to the president's timeline on Twitter, the president's timeline on Twitter, then you find the Minister of Police responding directly to that issue. And then he says, if you have a funeral, this thing of come to the police station does not exist. Don't come to the police station. Go straight to the funeral. If you've got a wedding, go straight to the wedding. You know, this is a kind of confused messaging that you have with this government.
All right, Mzwanele. I didn't think, and I want to hear what Dr. Malatsi has to say. I didn't think that the government has done so badly on coordinating messages on the virus. Yeah. Right? In fact, at the beginning, it seemed like they overburdened the Minister of Health to try and coordinate the message. Dr. Malatsi, what is your feeling? Do you think on the messaging front that at least they can be given a kudos that they have done well in terms of just getting the health practitioners to be the ones to talk? If it's not Minister of Health, it's MECs of Health, and all the others really were just coming in here and there, especially after the President's announcement. And Dr. Malatsi?
Yes, I think with credit, they've done fairly well in trying to centralize message and that there's a unified voice, particularly an expert voice. Yeah. I think the challenge with the size of the government that we have is that you'll always have over-eager, members of the executive who want to squeeze themselves into this wave because this is the biggest story happening in the country right now. And I think what is important from a communications and message framing and message control is to make sure that there is one or at least a credible source of daily updates to the public at a scheduled time, which is reliable, which will kill a lot of the uncertainty and fake news or hysterical reporting that may happen as a result of either the public waiting long for information to flow. So that is where I think the challenge is going to be into the next few days, so that some members of the executive can just learn to stick into their lane and let the credible voices of the experts, either be it the doctors from the National Institute of Communicable Diseases or the Minister of Health, but also so that there's an increase in mass communication. So the flow of information currently to people who have TVs, to people who have social media, it is all fine, it is accessible. What is more important is to penetrate the message into the communities who need to hear this message the most, particularly the precautionary measures about social distancing, about making sure that hands are clean.
Yeah, Doctor, just before we go to a break, do you think that the message has reached all corners of South Africa, particularly from being simplified and being communicated with languages of people and so on? In other words, we're sitting here, it's been 2 weeks since the first case. Do you think that the information was on the same basis, someone who is, in deep sleuth as someone who is in Constantia?
I think there was an effort from government to try to translate the message to our people to a certain degree. However, we feel from our side that we need to put the health workers in the forefront to translate this message easily. We need our doctors, our pharmacists, and those people that will assist in translation and will lead this program.
Yeah.
We also think that the NICD should also lead this program. I think so far the government has done their part. To a certain extent, there's that sense of awareness to say there is a problem in South Africa. You see people when you walk on the street, they are wearing masks, they are wearing gloves, although it's unnecessary.
Yeah.
But it tells you the message is there. Yeah. Government has communicated. I think the Minister of Health came well and honestly and transparently communicated that message. But we can still do more. We can rely on health practitioners. We can rely on NICD.
Malatsi, quickly before we go to a break, state of emergency, necessity or not?
Look, I think a state of emergency should be the last resort. Section 37 of the Constitution states that, it becomes necessary in a time of war where there's an invasion or a threat to national security. And also it does cover the part about a national disaster. But I think at this stage, it would be a little bit too early to do that. I think what is important is to increase the awareness around, hygienic interventions, all the self-precautionary measures that as individuals and members of the public that we can make, and to have discipline, discipline for those that have tested positive to quarantine, discipline for us, all of us as members of the public to stick to the guidelines for social distancing and not take chances, because if we don't do all those necessary things, it will become necessary for a state of emergency.
All right.
Can you take this thing quickly, Gigi?
Yes.
Before we go, I think with the issue of messaging, it's important that we must be more discerning as to what are the issues.
Yeah.
For instance, there's a debate even on social media whether is this virus airborne or not airborne. And there's all kinds of conflicting reports on this matter. Yeah. And the one says this, the other one says that. And another thing, this thing that the president has said, people must greet with an elbow. You've got the health experts that are saying you must sneeze onto your elbow. Now, having sneezed into your elbow, how do you use the same elbow to greet again?
No, wait.
So wait. So these are the things that actually create confusion, because at the same time, you are saying social distance, just be 1 meter away from each other. But having said 1 meter away from each other, then we must touch again. I mean, what is this? So I want to say that I think there should be no elbow greeting at all.
Elbow greeting. All right, just pause there, Mzwanele. I'll give you a chance to revisit that matter. Right. I think that everybody would agree that there's a way in which we have to change behavior. And the question is, to what extent do you change that behavior? That Bloem, I want you to lead us also on the state of emergency issue. If, as you all agreed, right, informal settlements are in danger because they don't have water, sanitation, etc. In other words, you are sitting on a time bomb right now.
Yes.
Where all you need is 1 or 2 infections in an informal settlement, and then you are having a crisis. How can that, in your view, be stamped, right? Because it's coming. If you have close to 200 cases, it means that you are approaching fast areas that are dense, areas that at the same time don't have water. We'll come back to that after the break. Our Frank Talk tonight, the political parties focusing on measures taken by government. Are they adequate? What should be done? And we're exploring those. You can, of course, also, if you want to join that conversation, send us your WhatsApps, tweet us at JJ Tabane at Newsroom 405. Let's take a break now. All right, good evening. As we continue our Frank Talk tonight with political parties, let me give you a chance just to round off the issue of messaging. Now, obviously, the cabinet is what, 30 odd or so ministers, and an additional 30 deputy ministers, whatever the big number is. Right? Each of them have particular focus areas. Yeah. So the Minister of Health is not going to talk about taxis and sanitizing of taxis. Yes. Minister of Transport will talk about that. Yeah. Right? Minister of Home Affairs will talk about closing of borders, etc., which I think is what is happening. So there's a central message, but all these ministers have to find, if you like, messages relevant to their area of work, so that we don't have Minister of Health talking about everything. Surely that's reasonable.
Yeah. No, but this is why we have a structure there called GCIS. It's meant to do exactly that, to coordinate government so that government can speak in one voice.
Yeah.
So there are certain clusters that are together, that have got a cluster message that is well coordinated and all of that. It can all get scripted. They don't have to appear clever and speak off the cuff. They can just read something that is well prepared so that the message is clear and the message is not conflicting. It doesn't make sense when you have a premier saying one thing who is the head of the province, and then you have a national minister saying something else. Sitting there as community, you get confused as to what is this now, who must you listen to? But I think right now, government has got a in fact, this is a God-given opportunity. This disease requires a lot of water. You must wash hands, must wash hands, must wash hands. So therefore, if they've never had a reason to create budget, to go and get kwakwa, to have boreholes all over the show, to get water and whatever needs to be done for kwakwa, to get water,
this is the chance.
This is the chance. Limpopo, Mamusa, Eastern Cape, this is the chance. So I think people of South Africa must see if this government is going to rise to the occasion. They've got a golden opportunity. God has just created a major opportunity to say to them, now that you've been dithering all this time, I've stopped everything. Now I give you dictatorial powers. What can you do with those dictatorial powers? Yeah. Can you go and give these people water? So let's see if they'll rise to the occasion. So, but I think we really hope they do.
Yeah, all right. I want to link that to the issue of the state of emergency. Surely, right, we are sitting on a time bomb where informal settlements are concerned, right? The fact that the president was able to say, look, we're limiting you to 100 people, right, shows you that those who can't limit themselves to 100, who are sitting as like sardines in these settlements, are in deep trouble, right? Could that be a need, a necessity for state of emergency? Because immediately you can deploy the army to those places to already not wait for an outbreak, but already make provision to actually intervene proactively. And I'm not quite sure, I don't have all the answers. I'm not sure how that can be done in the Bloem.
You see, lockdown is the answer to this problem. You see, JJ, if we are not going to end, you see the difference between a state of emergency and the state of disaster. We are not going to be like the apartheid government when we say state of emergency, skip, scop and donor. No, here is to save lives of people. Lockdown, I am saying, let us take the examples of other countries who have faced the same problem, like China, and now it's Italy.
So lockdown, tell me more, what do you mean lockdown? What will it mean? People must stop all activity.
The movement of people. You know, you can't move from this. You don't know. You see, let me take Diepsloot again.
Yeah.
Cordon off Diepsloot.
People mustn't go to work.
No. They can go to work, but they must be monitored. That is the only way how we are going to stop this thing. If we are not, you are talking, people must not go to, how many people are working in South Africa? People are unemployed. Go to Diepsloot during the day, 9 o'clock in the morning or 10 o'clock. You will think there's a factory there inside Diepsloot. People are unemployed. Now, if we are, you see, and that is the problem that we also see when it comes to this virus. It looks as if it is the elite that is getting more attention than the people in the informal settlements. And that's a problem. You see, you spoke about the message and language. Language is a very important and an instrument, a weapon. If you don't have people in a township, in a squatter camp, you must address that person ka Sesotho, ka isiXhosa, Setswana, Afrikaans, and so on. That message will go through.
Yeah.
But now, if all the ministers, now, the other day, I saw all the ministers there addressing a press conference in English, all of them. You see, and I noticed that thing. The traditional leaders, House of Traditional Leaders, have raised this issue of bringing the message over in mother tongue. It's very important. You know, let us communicate this message in mother tongue.
I want to understand.
But the issue of a state of emergency, it's very, let us cordon off places.
Do you agree with that? I mean, what would be your solution if you're in charge on dealing with informal settlements? Because I'm afraid that we're going to wake up late, you know, when there's an outbreak in an informal settlement, and you know, there are ambulances going in and out of there, if at all, if they arrive on time at all, to take people out and what. It seems to me that this is one area where there must be proactive intervention, Doctor.
Thank you very much again. I think, JJ, let's go back a little bit. Unfortunately, our people had to suffer the outcome of the ANC, the corrupt ANC. And as we are speaking, the very same people that we are mentioning of human settlement and so forth, the people in Sekhukhune without water, they were supposed to be provided with houses, they were supposed to be provided with water. Unfortunately, if this virus happened to get there, it's going to be a crisis. Hence, as the EFF was saying, let's manage the situation before it gets there.
But how?
Let's impose quarantine, state quarantine, and monitor all the people that are having this virus who are tested positive. Let's find a place for them and isolate them, and only release them when they have recovered. To avoid this disease, to go to human settlement, I mean, go to trades, for example. People go to work in the morning. Go and see how packed are they. Now, the question is, how are you going to manage them? It's going to be difficult. Let's manage this problem. Currently, we're still in a better condition. We're not like Italy or so forth and so on. Let's assist in providing water and sanitation in areas like Sekhukhune. I mean, there was a reporting 2 weeks, 3 weeks ago of children at school who are sharing, 600 children at school who are sharing a toilet. Now, we don't want the situation to get to that point. Let's avoid it at all costs. We must arrest this thing. Let's force all these people who are positive, who tested positive, to quarantine themselves and be monitored by the state. That is the only way to, even not to talk about the people in Mzwanele and informal settlement, people in the trains and everything. If we don't do those things, most of the poor, the marginalized people, our own people, are going to be wiped of this earth because they are not resourced. Currently, this problem is affecting the few elites. That is the advantage of South Africa currently. It has never been reported. So we are saying to you, let's arrest the situation. Let's contain it. And to those areas where there's no...
He's suggesting a lockdown. Do you agree?
Yes, let's do a lockdown. But a lockdown, let's first start and dealing with the situation at that particular... quarantine. Let's get it right. I've mentioned Robben Island, and to many South Africans, it becomes a joke. We're not imposing Robben Island. We understand Robben Island was meant to be a prison. Correct. But we can convert that facility into something positive for this country. I mean, China has just built a hospital in a few days. We can convert that Robben Island. Advantages of Robben Island is it already isolated. We don't want this problem to affect this. The second part that we can do, we must keep on testing, and testing. We must ease the condition of testing. Currently, JJ, you need to qualify
to test.
To test. You need certain criteria. You must qualify. So
We're going to take a break there. I want us to pick up the conversation about testing, right?
Yes.
The issue about testing kids, the issues about whether you should go to a hospital to test, where there are other people who could be infected. I want to hear your views about how we deal with that. Let's take a break now. I think that this is going to improve our society overall. We'll continue with our frank talk with political parties, representatives from the EFF, the DA, the ATM, as well as the Congress of the People. Gentlemen, I want us to, in the remaining time, just to talk about this whole issue of medical response now, right? You know, in your view, is it clarified enough that if a person is ill, they can go to a facility, they won't be chased away? This week we had a story where people are told, no, go over the counter to get your flu medication. Because if you look at our facilities, if you go to Baragwana's hospital, it's a jumble, right? There's lots of people there and so on. Then you come there, you are infected. They tell you, no, go away because you are just having a flu. Meanwhile, you are in fact positive. You don't even know. How do you think that can be handled, Mzwanele?
A few things, JJ. First, the first point is the issue of quarantine. Let's start there very briefly. That the government can use these current regulations in the first place to outlaw self-quarantine. Self-quarantine is very dangerous to the people at home. Because when you arrive from the airport and you've decided, because you are this very important person that is going to self-quarantine, you get home, and you get home, you come across your gardener, come across somebody that helps you at home, etc. Everybody else that you are not going to tell, by the way, that you have this problem, is actually at risk. So therefore, government must clamp down. As soon as they find that you are the target of quarantine, there must be no option to self-quarantine. That's the first point.
Yes.
The second point, I really just want to touch on the issue of the economy quickly. But before that, I think all clinics should be declared testing places, as it was screening places and testing places. The two are not the same, but both those operations, all clinics should be able to do this. Shouldn't have to go to a hospital to do this. Clinics should be able to do that, and with all the support that this government is getting from business and from everybody, it should be a no-brainer to do this thing. Jack Ma has been offering kits, has been offering all these other things. In fact, this is a call to business people. They should be ashamed that we should have a Jack Ma making all these kinds of contribution. This is the time that business should be making a contribution instead of these empty pledges that they've been making, that even today we don't know what they've done with these pledges. So we are saying, for us as ATM, that this thing has impacted the economy. People are not able to live their lives properly. Their cash flows are a mess. So therefore, government should use this opportunity to say to banks, to say to insurance companies, to say to all those big creditors that now that we've got this national disaster, you shall stop debiting people for their bonds. People must stop paying for bonds for the next 4 months. People must stop paying for their cars for the next 4 months. People must stop paying insurance for the next 4 months because their businesses are not able to sustain their lives.
Tenodi yesterday said that's not on the table because business through Rasitabo, who was here, we're talking about taking lessons from Italy, where tax has been suspended because of the disaster. From a business angle, is the DA considering business measures such as the suspension of taxation and also suggestions made here by Mzwanele about the suspension of mortgage payments?
My colleague probably read our document that we presented on Thursday, because in there we are proposing a 4 months forbearance for loans, 4 months forbearance for rental for businesses, because ultimately you still need the economy to function, and you need to provide relief for people that make the economy work, and to make sure that there wouldn't be an immediate loss for loan lenders or financial institutions, because all you're doing is to provide that relief for the interim and pushing it back by an additional 4 months.
Yeah, but in a free market economy, how possible is that? Would that require a decree? It sounds a very drastic measure to say to a bank that has a relationship with a particular customer with particular context.
Yeah.
To say stop bonds, because it doesn't mean that business itself will stop salaries necessarily because people are off work. How will that work?
This is where engagement becomes possible, because we are not under normal circumstances. We are in an extraordinary period because we are in a state of national disaster. So we need to engage, and I hope the Minister of Finance is doing those engagements together with the Reserve Bank and the financial institutions, because if they don't come on board now, they will also feel the consequences beyond this virus being cleared in our society. So be it the private sector, political parties, religious organizations, we all need to play our part in our spaces of influence to contribute towards every proactive solution that can help the country defeat this virus.
All right, gentlemen, I'm going to ask you to give me your last word in terms of what there may be many things that government is doing, announcing a state of disaster, etc. What's missing? What are the one or two things that if government is watching and somebody from an interministerial committee on this disaster is watching, what are the one or two things from your end that you think must be put back on the table quickly? Let's start with you, Ntate Bloem.
No, let's address the shortcomings, especially in informal settlements, water, toilets, things that is necessary for the people on the ground. But our message as the Congress of the People to everybody in South Africa, let us help and strengthen the hand of government. It does not help. This problem is the problem of all of us.
Yes.
And if we are going to point fingers, all of us are going to suffer. All of us are going to go down.
How's Parliament involved? I mean, are political parties involved somewhere other than being outside commenting? Are you drawn into some or other committees that are helping government quickly?
Well, yesterday the president had a meeting with leaders of political parties, and I think that is involvement. The president and the leaders of the political parties have said and commit themselves that we, as the Congress of the People, we were meeting today. The president of us, who was there, was giving us very straight and strict directives to say that let us do 1, 2, 3, 4, 5. All our members must be in the street. All our members must help with the measures that the government have put. That is how we are helping.
No, thank you. Dr. Matsetela, what are the one or two things that you think government has to urgently address?
Yes, number one, critical, very critical. They need to address the issue. They need to ban this self-quarantine. They need to impose quarantine. It must be compulsory. That is the first thing. Government needs to take the resources to the municipal level to assist those people without water there, without all the resources and everything. And then the other things is that what Mzwanele, we've actually raised a number of issues. All banks must suspend payment of the loans. We must suspend all those for 4 months. We must suspend all those car payments. We must suspend all those difficulties that our people are finding themselves in. There must be at least people who are earning less than 15,000. Those people need assistance from government. Government must see to it that they have all this sanitation, they have all these things that they will need. So it's compulsory. We feel that government must assist those communities, those families. Lastly, before briefly, we need to rope in the private sector. We need an assistance, and private sector must not take advantage of the situation currently, JJ. These issues I must raise. is that when it comes to testing, other private sector are testing, but they said those results are not conclusive. Somebody has to pay 1.4, 1.2 and have a test on the results that are not conclusive. Well, we say the final result will be concluded by our national laboratory. So private sector must assist, and we're going to have a situation where this virus is expanding. We're going to need the assistance of private in terms of resources.
Point well made. I'm going to stop you there. Yes. I'm left with only 30 seconds now. And Malatsi, one thing that government must attend to briefly, please.
Yeah, look, I think what is important right now going forward is amplifying the message on the precautionary measures so that they filter through to every corner of the country, be it informal settlements, villages. So every public facility should have that information. Every community radio station should have daily updates on this, and for the telecommunication companies to play a role in daily reminders to the public. But I think government must also fast-track the process of getting former health professionals to assist the current ones, because the demand for medical assistance, be it testing, be it regular screenings, is going to increase in the next few days as we go forward. And for all of us to be responsible.
Thank you very much. You've got 30 seconds.
This is a great opportunity for government to get the young people to be busy. So they must make sure that the young people are part of the solution. They can give them even little stipends and make sure that they go and distribute pamphlets. They go and do this education to the people out there. And lastly, for us as opposition parties, I think our role must not be confused when we become critical. That this is not a time to be in the yoke of supporting and at the same time putting our guards down. For us as ATM, we're not going to put our guards down. We are going to be supportive of this government. We're supporting this government. We're supporting all these initiatives. But that does not mean that this is a license to loot. We're going to make sure that we become the vanguard of the people, to make sure that we're very vigilant, that this is not we're not going to have a corona gate after this. Yes.
One minute. Yes, thank you very much. I need to say this. I think there is a lack of, most of our public institutions, the clinics and the staffs are not trained there. Government need to make sure that all staffs are trained. A person with coronavirus can pitch up anyway. The staff must know what to do, what must be done, and who to contact. Thank you very much.
And we leave it with a state of emergency.
All right, let's leave it there. Gentlemen, thank you so much for your time. And I hope you enjoyed the frank talk. And we all have to do our bit, and the political parties today put in suggestions that I hope government will take seriously. Let's take a break now.